The two STIs, HIV and AIDS, are short for human immunodeficiency virus and acquired immune deficiency syndrome, respectively. When a person is suffering from an HIV infection, the symptoms fall out in three stages. In the first stage, which is an acute infection, the person may suffer or have symptoms of flu or influenza. In the second stage, which is also known as clinical latency, the person is still not affected by the deadly AIDS virus, but still the HIV virus multiplies at a very slow rate. And in the third final stage, which is known as AIDS, it is considered to a person is considered to have AIDS when the CD4 count falls below 200 millimeter cube in blood. And without any treatment, a person may only survive for 2 or 3 years.
HIV is transmitted through bodily fluids. These include blood, semen, vaginal and anal fluids, as well as breast milk. There is one main treatment of HIV, and that is antiretroviral therapy, also known as ARV. Although there is no cure for HIV, this treatment slows down the growth of the virus. Newer treatments for HIV involve preventing people who are at high risk of contracting the virus. Pre-exposure prophylaxis, or PrEP, reduces the risk of contracting HIV by sex in 90% of people if used correctly.
When a person is suffering from an HIV virus, it is not just the physical unhealthiness but also the social stigmas that affect a person. HIV and AIDS are always associated with death. HIV is associated with behaviors that some people disapprove of, like homosexuality, drug use, sex work, or infidelity. In HIV, it is not only transmitted through sex, which is a taboo subject in some cultures, it also is transmitted by using different syringe injections or through other sexual contact.
HIV is not a death sentence anymore, and people can live a long life with an HIV diagnosis. 63% of millennials believe the government should spend more on HIV and AIDS versus the 47% of boomers and seniors. The biggest problem with HIV now is the stigmas that people give it. HIV is not a death sentence anymore, and people can live a long life with an HIV diagnosis. 63% of millennials believe the government should spend more on HIV and AIDS versus the 47% of boomers and seniors. The biggest problem with HIV now is the stigmas that people give it.
The first step to prevent the spread of HIV is knowing your status. It is very easy to get tested, especially on college campuses. Free and confidential testing is available on Indiana University's campus through Positive Link, a free HIV prevention and treatment center. The risk is not knowing. Get tested.